We turned 90, moved in together, then got the vaccine. The UK's COVID vaccination programme has begun, with the over 80s and some health and care staff first in line. Two dancing partners who only became a cohabiting couple at the age of 90 were among the first in the queue in Bradford, where Dr. John Wright of Bradford Royal Infirmary got to hear about them. As with so many great romances, it all started for Lily Abbot and Trevor Hirst on the dance floor. They first met through Bradford's sequence dancing circuit 30 years ago, became good friends and would travel to events around the country together, Lily partnered by her husband, Wilf, Trevor with his wife, Rita. Trevor gave up after Rita died 6 years ago. At the start of 2020, the year they both turned 90, Lily, who is 6 days older than Trevor, calls him her toy boy. They were still living separately. "We didn't realize the seriousness of it at first, but it's been horrendous," says Lily. One day early on in lockdown, she and Trevor went out for a walk together and Lily fell and cracked a rib. Trevor said he'd come and live here because both my children and his wanted us to do that. "I was frightened by my fall and he came here and I said, you might as well stay, rather than go home at night," says Lily. Now they are living over the brush, as Lily puts it. In Bradford we have set up 4 vaccine hubs across the city, 1 at Bradford Royal Infirmary and 3 in primary care. Lily and Trevor were 2 of our first happy customers. "We know that we will need to vaccinate around 70% of the population to reach herd immunity to stop the chain of viral transmission. Age is by far the biggest predictor of severity of disease and death, so the vaccine strategy is focused on the over 80-year-olds to start with, moving then to over 70s and so on. In the hospital we have been getting our weekly delivery of 1 tray or pizza box of 195 Pfizer vaccine vials every week. The national guidance recommended 5 doses per vial, allowing us to vaccinate 975 people every week. Every day our carefully choreographed vaccine hub receives the over 80s, care home workers and frontline staff. There are always some no-shows, so hanging around at the end of the day for any leftover vaccine is a good strategy for staff in the hospital." Queuing for her COVID vaccination brought back memories for Lily, who has lived in Bradford all her life. "Bradford was wonderful in those days, the mills and the shops," she says. Lily remembers Bradford's 1962 smallpox outbreak, which led to more than 200,000 people in the city being vaccinated against the disease. "It was awful at the time, but the vaccine cleared it up," she says. Trevor, who worked as a wool sorter in Bradford's mills, remembers getting his smallpox vaccine, too. "This time round we queued with some of the others from our dancing groups and that was much more fun. We were all so excited, as it means we will be soon together again," he says. Lily is also crossing her fingers that the vaccine will allow them all to get together and dance. Sadly, that may not be possible for a while, even if all the dancers in the groups get vaccinated quickly. Vaccines administered into the arm tend to be very good at protecting us from illness, thanks to the antibodies in the blood, but may not stop transmission of the virus. For this you also need the antibodies in the nose and throat. So even after their second injection, we can't be sure that Lily and Trevor will not catch and pass on the virus to others. Furthermore, some of the dancers may be among the 5% of recipients not protected by the vaccine, though we hope it will reduce symptoms. "I am confident that Lily and Trevor will get back on their dancing feet as herd immunity eclipses the virus and eases it out from our daily lives, and this will be sometime in 2021, when we have vaccinated around 70% of the population."